But let me introduce one by one the four speakers on this health session. And the first person I'm going to come to is Yasmeen Qazi. Hello, Yasmeen. While I introduce you, she's a medical doctor with vast experience in public health. She's a well-known reproductive health expert and advocate for women's health issues in Pakistan. She's served as an expert on many task forces for various policies and programs. She's worked closely with donors and NGOs on reproductive health matters nationally and internationally. And Yasmeen, I'm going to ask each of the speakers in turn just to give a quick snapshot, first of all, of what you're seeing on the ground of the issues that are revealed or produced because of COVID.
Thank you, Jude, and thanks for giving me this opportunity to speak and to just talk about this very pertinent issue. I think when the COVID arrived, I mean, globally, but in Pakistan, there was the usual panic and there was like confusion and there was not a clarity about anything else. So what we saw and what we witnessed, because women health issues are always sidelined or they fall into the creeks, especially the reproductive health issues and access to contraception or access to safe abortion, things which are always considered a kind of either unnecessary or controversial. And when the crisis happens, of course nobody pays attention to it. So our first drive was really to see that it is considered as an essential service in the national COVID action plan, which was designed and created at the prime minister level, at the federal, and then they had the provincial similar bodies. So what we really did, we come across as an advocate of women's health issues, and we really asked them to include maternal health, reproductive health, and family planning as one of the essential service, which means that they allow, despite of the lockdown and despite of I mean, there was a great restriction on the movement initially, that you allow those facilities with all the protective equipment to operate. And then you always you're also trying to see how you can reach women in their household and in their communities if they are not able to come out. We were especially concerned about, because what we quickly worked on the data, that there is currently like 5.5 million pregnant women in Pakistan at this moment, and we are going to have nearly 1.5 million live births in the next 2 months. Pakistan is one of the most populous country. We have a very high growth rate. And what about these women? And then there is more than 5 million women who are using contraception. And what are they going to get for the resupplies and how they are going to get it? And if they don't get it, they will be experiencing unsafe pregnancy, unsafe abortions. So things like that, which was critical, but we had to really work hard to make everybody realize, because it was all about COVID. But I must say, working with civil societies, working with young people, working with our youth champion, especially our women and the girls champion, was really the kind of a solution, a local solution. It was very iterative. It was changing every moment, but we were able to at least do, some mechanism to reach out to the women who were in need. And then quickly, we all worked as a technical expert with the government to see how can we prioritize those women. So looking at those pregnant women who are high risk compared to those women who will be delivering normal, and then try to see only those come to the facilities. So things like that, trying to continuously look at the situation and trying to come with local solutions, and then try to tell government that you can really scale it up.
Okay, thank you.
So
I'm going to come back to that. That's a fantastic
sure.
snapshot. Next, let me introduce Professor Agnes Binagwaho, who is the Vice Chancellor of the University of Global Health Equity in Kigali, Rwanda. She's currently a senior lecturer in the Department of Global Health and Social Medicine at Harvard Medical School. She's Professor of Pediatrics at UGHE, as well as an adjunct clinical professor of pediatrics at Dartmouth Skeasel School of Medicine. And also, you're very busy all the time, Agnes, raising the awareness of the issue of women's health, which of course spans everything. I mean, women's health isn't just a medical issue, is it? It's a social, economic, mental, as well as physical issue. But give me a quick snapshot, both from Rwanda, perhaps Pan-African, and your sense at this moment. Right, we can't hear you. Sorry, Agnes, I'm going to have to...
I should have a T-shirt. I'm on mute. Sorry for that.
We've all got that t-shirt.
COVID, yes, so COVID has a health impact and an economic impact. And the economic impact will have ultimately a health impact, but not only on women, on the entire family, because we know that when the woman is healthy and active, the children are better. For example, with the lockdown and family being packed sometime in not so good condition, there was an increase, an evidence increase of gender-based violence, a serious increase. And the world was not ready to take that shock. There is also an increase in general on vulnerability of women, especially the poor women, because we know that even on Earth, 60% of women work in the informal sector. So, lockdown, you cannot go out, you have no income, nothing to feed the family and your children and yourself. So, they were at higher risk to get infected because they broke the lockdown to go and save the family. And the last thing we can say, on the frontline workers, they are predominantly women. And among the many people who die fighting to save the life of others, there are so many women that are that are not recognized. So the solution have to pass to women at all level, economically, service delivery, equipment, and also better safety net for women.
Mm-hmm. Yes, thank you. I think that kind of whole idea that women are the frontline workers and they're also the frontline domestic worker in their own house, childcare, putting food on the
Absolutely.
table, all the rest of it. And so they have a double likelihood of serious health issues.
Absolutely.
I mean, and serious
Absolutely.
over responsibility and underpay, if they're paid at all. Uh, Sonia, can I come to you? Sonia Adesara is an activist, medical doctor, and former National Medical Director's Clinical Fellow. She was named the Future Shaper of 2019 by Marie Claire magazine, and last year she received the Asian Woman of Achievement Award. You are an activist able to, I suppose, take a bit of an overview, but also, you know, UK is one of those places that people often say to me, well, it's probably not like that there, is it? You know, too often I think it is assumed that countries that choose to call themselves developed reveal themselves actually to have huge fault lines in terms of care in all levels. What's your sense at this point, Sonia, of the COVID crisis and women's health?
Yes, definitely. I agree with that. And I hope maybe some people watching this may be living in countries that have governments who might have been a bit more effective in controlling the virus than we have in the UK. But actually, what the previous speaker said already really resonated with what we're seeing in the UK. And I think that shows, yeah, although we have different healthcare systems, actually how this virus operates is very similar globally. So this pandemic, it is exposing the cracks and the vulnerabilities of our healthcare systems and of our social infrastructure. And it not only exposes, but it aggravates the deep inequalities that exist in our societies, whether that's gender inequalities, economic inequalities, racial inequalities. Those in our society who are already discriminated against or who are marginalised are the ones who are more likely to have poor health, more likely to die from the virus, and a lot of the time more likely to be exposed to the virus in the first place. And we are seeing that very clearly in the UK. So black women living in the UK, pregnant black women are being admitted to hospital with COVID at 8 times the rate of white women. They are more likely to die from the virus than white women. We're seeing those that live in the more economically deprived areas are also dying at higher rates. And also what we're seeing in the UK, and something that we've also seen in previous pandemics, is that the indirect impact of the virus, and that's disruption to healthcare services, the disruption to the economic system and your social system, that indirect impact is wider and much more deeper and long-lasting than the actual direct mortality that you get from the virus. And again, we're already starting to see this in the UK, so increasing rates of gender-based violence, as mentioned. We're seeing increasing mental health problems, increasing numbers of unplanned pregnancies. And again, it is those who are discriminated against and marginalised and those at the sharp end of inequalities who will be disproportionately hit by these indirect impacts, and their health will suffer as a result. And that consequence and that impact on their health will be there for decades and decades to come.
I mean, it's certainly true that one of the huge incentives for putting together Wow Global 24 in about 7 weeks, which is what we did, was just the horror of recognizing that the impact of COVID in all of these different ways was going to disproportionately land on women. And as you say, it would have a generation after generation impact if we didn't find a way of getting together and talking about it and seeing what we could do to limit the damage, or at least use this moment to change the future. Collie, I'm going to come to you. So Collie Mashaba is the district coordinator for Mother to Mothers in South Africa. And she works with the community to provide vital support, maternity health and counselling services to local women. You were diagnosed with HIV when you were 19. So you've also navigated the not just your own health issues, but society's attitude to health issues, society's inability to deal with warnings, knowledges, and epidemics, if you like, and not provide the respectful and appropriate care when needed. So, Collie, what's the snapshot that you want to give us on the ground from mothers to mothers at the moment? Can you hear me, Collie?
Unmute.
Unmute, Khalil. Right, I can't hear. Let me come
Okay,
back.
thank you again. Thank you for having me. Yes, I can. Oh, thank you again for having me. Can you hear me now?
Yes.
Thank you again for having me. You know, with South Africa, we're actually at over 100. Thank you for having me.
Right.
Hello?
Hello. We're having a problem hearing you. I think there might be an internet connection issue.
Can you hear me?
Collie, can I come back to you and ask the technicians to have a look at it?
Thank you for having me. Thank you again. With South Africa, we're actually at over 100,000 cases, and you know, South Africa has now become the epicenter of COVID-19. And for us, hello.
Okay, I'm going to ask Hardeep. Would you look at Khalil's connection while I come back to everybody else? Okay, so Khalil, I'll come back to you when we've solved the connection, which I hope we will. So women, health women of the world, if we can kind of gather together, let's just pick up on some of these themes. And I think the first thing I want to ask, and maybe I'll ask you, Agnes, first, is when people realised the epidemic was coming our way, and obviously it's come in different places at different times, did you, as women working with grassroots and also working at NGO and government level, did you get asked to come to tables that said, right, let's put in place deep planning now to deal with reproduction and contraception issues and issues around abortion, issues around distribution of health, the issues about frontline workers, domestic abuse? Were you brought together as expert women in order to advise
in Rwanda?
In Rwanda, yes.
In my country, yes. But it was not when the first case happened. It was almost when the outbreak was really taking off in China. Because we have economic report with China, we had a flight going there. So the country take action before having any case, because we were susceptible to have a case. So the Minister of Health called all the stakeholders, not only the women, the youth, the religious, the private sector, and start talking, explaining what is this new epidemic. That it was an epidemic at that time, and what we should do according to science if it happened. that if it happens, we will do like China. We will lock down. And if we lock down, the poor will be poorer. So how can we do to identify the poor? How can we do to make sure that each child and each vulnerable will have something in the plate? How can we do to bring back all the children back at home? And because it was well prepared, the burden on women was not so high because the safety net for the nation was in place. So the 14th of March, 2 months later, when the first case happened, the country locked down totally over the weekend. It was a Friday night, and on Monday, all the children were back at home, etc., etc. We didn't close the university. We asked the permission because we have international students without families in Rwanda, and we had international teachers and families on campus. So we keep the campus, but like a little town, we lock down the campus and apply everything. So the country was prepared with a focus on the vulnerable, how to bring them food on their table, how to make sure that they respect the lockdown. Because it's so crazy not to take care about the vulnerable, because if they are going to die because they are starving, they will make you die because they spread the disease. So the rationale behind the national response that was led by the Ministry of Health was great. And as an example, we are not a rich country. We don't have an elastic budget. But first thing, the president give 1 month of his salary for the vulnerable so that we can buy food. Then all the government give 1 month of salary. Then all the leaders in the country give 1 month of salary. Then all the neighbors give money for our neighbors. And we know who is the vulnerable. It has created social cohesion. And people have really abide to the rules because they had everything they need.
Mhm.
And this has helped us to control the disease. We had only 2 deaths, and both of them came from one from Tanzania, a Rwandan who came too late, and one from South Sudan, a young woman, 24. We cried, really. All the country mourned her. We cried. 24 years. She was a policewoman in the UN workforce in South Sudan, and she died. So I think that the success of the response in this country is linked by the fact that vulnerable are taking an account and women are taking an account.
Yeah.
And
And
everybody is on the table to discuss.
okay, now I think that is a fantastic example, and I think it's an important example to give. But it isn't all governments, it isn't all societies that are ignoring the dispossessed. Obviously, Rwanda has a very painful history that forced new conversations to happen, and that those set of new conversations, including a complete kind of restructuring of parliament, so that women had a much greater say in parliamentary affairs. I think it has to have had an effect. So I'm going to ask Sonia whether you feel as if, again, the UK government took into account the vulnerable, the dispossessed, brought women to the table fast and clearly and equally in the way that Agnes has just described.
Yeah, I don't think it's such a positive note in the UK. I think generally the UK was quite slow to react to the virus, and particularly around women's health. I just don't think it was considered at the start. So if you think about abortion, for example, so we have laws in the UK, in England, Scotland, and Wales, which are quite specific on how and where an abortion can happen. So abortion can only happen on licensed premises. You need to go and see a doctor. You need to have two doctors signed for you to have the abortion to happen. So obviously these laws and these regulations will make it very difficult, particularly with lockdown, for women to have abortion. And it wasn't the government. It took women's rights groups and activists across the country to force them to change legislation to allow the abortion for women to have the abortion pills at home, and also for allow telemedicine to happen. So I do think the UK was a bit slow on the mark here of thinking about the impact that it would have on women's health and sexual reproductive health, particular. But there are some countries have been better than others, and some countries have been worse. At least UK has made progress. I think some other countries in Europe, including France and Italy, said sexual and reproductive health cannot be compromised during this pandemic. It is an add-on, it's an essential service. And then if you go somewhere like US, you've seen anti-abortion activists exploit this issue and try and restrict women's access to abortion, saying that women can only have abortion unless it's so there's been, I think, quite a wide spectrum case sort of sits in the middle, and how we've dealt with that. But contraceptions have really suffered there as well in the past few weeks.
It's certainly been unnerving, not just on issues of health, but social justice generally, to feel that there is an exploitable moment here for governments that wish to push back progress or build in new agendas. And reproductive rights is clearly one of them. Khalil, we've got you back. Hello. Can you hear? Hi.
Yes.
Lovely to have you. And I'm even if the internet was a little bit frisky, I'm glad to see you again. Can you just give us your sense of what's been happening in South Africa?
Oh yes, thank you again for having me. We've actually been over 100 cases in South Africa of COVID-19. What's actually been happening right now is that with the limitation of transportation, and then the gender-based violence being on the rise, and then, as you know, we women actually have to bear all the brunt, the women and the young girls, because you've got households where they are actually being had by women, and then if now they are not working, and then also the unemployment rate has actually gone very high. And then also with the GBV cases, going back with the GBV cases on daily basis on the news, you hear roughly plus minus 10 or 15 rape cases on daily basis. So this goes to show like the COVID-19 has actually played a huge part, like a big impact in our community. And with also when it comes to the health sector, that the disclosure rate, those who haven't disclosed are actually struggling now to take their medication, because everyone is at home. We're all at home, stuck at home, so they can't even take their medication properly. Family planning, people have restricted access to actually go outside. They have to be indoors. If even if the I think even if they want to go to the facilities, like to the clinic, there's no transportation because it's limited. So it's just we're actually taking the blow now.
Yes, I think it is an extraordinary thing to me that there has been so little forward thinking. I mean, obviously it happened quite quickly, but on the other
Mhm.
hand, I think it was very obvious immediately, if you say we're going to lock down a society, the repercussions in a way should be all on the back of an envelope, because I think we could have all said this was going to happen, whatever. And I wanted to, this ongoing issue of medication, I mean, cancer care, reproductive care, um, all kinds of issues, HIV, etc. The, the global impact on health, not just women's, of course, but specifically on girls and women in many cases, that's going to be felt for generations, isn't it? Is that conversation, do you feel after this period of lockdown, Collie, that people are now trying to put in place new ways of communicating? Do you see anything that's happening in South Africa that is saying, okay, we'll need to do this much better when we build back?
I think yes, I'm seeing it a lot, especially with even us as our organization. We've actually felt it because right now we're actually planning ahead, like having new virtual. We're actually planning new tools to like work virtually with our women and girls if need be, that we can't go to one-on-one with them. So like South Africa is actually planning a lot.
Yes, good, good. And can I just come to you now, Yasmeen, Pakistan? I mean, you've named the things that have been going wrong, and at the same time, as you say, Pakistan being one of the most populous countries in the world, we need to look to Pakistan and all the kind of ideas of female leadership and say, tell us what's the map for getting back out of this, but also doing things differently in the future.
Okay, yeah. So I just want to also, I want to begin this conversation by saying that what we are seeing is that it's going to be a very long-term impact on girls and women, even when, and hopefully soon, whenever COVID is over. because what's going to happen because of the socio-economic impact which the colleagues are talking about. We know that poverty is increasing. We know there is much more people who have lost the job, and poverty has a women face in Pakistan as it has in many developing countries. So
Yeah.
what's going to happen? The girls will be pulled out of the school if they are lucky enough to be in a school. They'll be pulled out of the school, and they will be pushed into early marriages, and so we are seeing this is going to happen. uh, we also are seeing a tremendous increase in gender-based violence, like everyone is seeing, and it has happened whenever there is a calamity or a crisis. We have seen in the earthquake that happened, the big earthquake in 2005. In 2010, we had severe floods. In every such situation, we have seen the issue of the sexual violence and gender-based violence. But we are seeing that it's going to impact the girls a lot. And in Pakistan, actually, we have done some great gains in that field because we have been able to raise the minimum age of marriage to 18 years, and we were trying to convince parents to let their girls stay in the school and things like that. And we are very worried about its reversal. So, like I said in the beginning, for us the best strength is our communities and our community workers. We have one of the best lady health workers program in Pakistan. Is a health program. They go to door to door. Right now, they got suspended because they didn't have the PPEs. They were not allowed inside the house. The household is scared. They were scared themselves because they are also women. They are mothers. So, but we are trying to see how we can provide them the equipment so they can be mobilized. The new things that have come up and that we feel have, sometime this calamity also gives you an opportunity. The one thing that we have been doing from ages is the budget advocacy. Pakistan has one of the lowest percentage GDP spend on health, and we are really now that like Sonia was saying, it's even the very advanced countries. It's the US and UK. We are seeing that how health system got collapsed, or all the fragility, and now we are really really trying to advocate. And when we get good budget for health, then we are able to have a more budget for the reproductive health and women's health issues. The digital, I think the new things that have come up is the telehealth and digital health, which was already happening in Pakistan, but it was a slower speed. Now everybody is scaling up. The donors are investing money. The government is doing it. So there are digital. The women can get consultation from the gynecologist through the Skype and all that, and the helpline for gender-based violence for any health services. So this is something that's happening with a very rapid pace because we see this is going to continue. And through technology, we are training the healthcare provider. We are giving new information because women have now new questions. They want to know, can they use contraception in this? Can they have the injectable because there is a COVID fear, or if they are COVID positive, should they use contraception or not? So we have to give. So this new normal means the new technologies, the new way of capacity building, but also the new information that needs to be devised. And we are trying to reach out. Luckily, Pakistan has one of the highest user of mobile phones. So at least there is a connection that we are trying to see how can we reach out to as many women, as many girls as we see, as we can. So this is the digital has come up really very fast, and everybody's putting up resources in it, effort in it, because we don't know how long will this last. But to be honest, since access has always been an issue in Pakistan for women, which are usually not financially empowered, so I think this digital technology can really bring them much closer to the providers, to the healthcare. And in Pakistan, like all of my colleagues are saying, 70% healthcare providers are women. So so their own safety, their mental health, and their protection is also something that we are advocating for. How can we make sure that the women healthcare providers should have safe all the safety measures? So these are a few things, but involving more and more young people as champion, I will say again, is something that's coming up very fast, and they are really playing a good role.
Yeah, I think the rise of the voice of young people is something that we are all relieved about. We welcome it. It's important. Intergenerational learning is absolutely critical now. But I think also
Yeah.
you've raised two things. One is that, abortion, rape, sexual harm, um, reproductive rights, these are things that people still struggle to talk about. We have to kind of get rid of all shame, all taboo around menstruation, about menopause, all the things that are to do with women's health. collectively around the world, we've got to stop people trying to shut down those words and open up and give women the right to their bodies and the right to not just own them, but delight in them, delight in the complexities of our bodies. And this is something which, again, out of COVID, we've got to try to do. And then when you talk about digital health, and this is going to be a wonderful and is a wonderful new opportunity, but it also highlights, of course, the digital divide, not just those who don't have digital access, but also those in a coercive relationship in a different problematic situation where they're not really allowed to have access to digital equipment they might have. And so coming to you again, Khalil, in terms of South Africa, the issue of rape, the issue of unwanted pregnancies, the issue of violence, and we're going to come to a panel shortly on specifically on domestic violence. But is South Africa able to talk about these things now and say not only we've got this issue, but we're going to find some solutions? So what solutions are you seeing coming up now for dealing with violence against women and sexual health inequity? Are there solutions that you're beginning to feel optimistic about? Are you on mute by any chance, Khalil? Okay, I still can't hear you.
You can't hear me still?
Now I can.
Okay. There are solutions. We need to work as a team. Because, okay, for example, we as an organization like Mothers to Mothers, we do household visits, we are at the facilities, we work with different partners hand in hand. So in our platforms where we meet with the different stakeholders and partners, we actually discuss this kind of challenges. That what do we do in terms with the young women, the young girls? How can we assist them? How can we keep them safe? So there are solutions. It's just that we need to work as a team. And then the government needs to adopt on that at the end of the day.
Mm-hmm. Yes, I think we need to work as teams in terms of cross disciplines in countries, but we also need to work globally as teams. And since this week, this month really, I mean, today is Black Pound Day in the UK, and specifically over and over again, we need to understand social inequity, but also racial inequity, and how the distribution around the world is so unequal. Can I come to you, Sonia, for what solutions are you seeing to problems that have been so vividly spread out there?
Yeah, just though talking about gender-based violence and increasing rates of it, again, we're seeing that in the UK as well and across the world.
Yeah.
And it's always very difficult to leave violent or abusive relationship at times like this. More difficult if you don't have financial security to do so. And that's something that we see a lot in the UK, and there's particular groups of women, particularly ethnic minority women, racialised women that have lower financial income, even more difficult for leave. And then we've got an added situation in the UK where migrant women, particularly migrant women that are undocumented, it's even more difficult for them to leave because there's a real risk that if they go to the police or try and access services, then they will get referred to the Home Office and could be put into detention centres. So there's things that we can be doing right now to help these women. So of course, having refuge spaces for all women available, and we need to be increasing the capacity of that in the UK, but also making sure that women have that financial security and financial backup to help them leave. And there should be a sort of a zero, we call for a firewall, but unfortunately it's not happened, that police department and public services shouldn't be, if a woman's coming and trying to leave a abusive or an exploitative relationship, they should be looked after and cared for, and there should be no connection there with the Home Office. So that's something that we're calling for in the UK to try and protect women, all women, including migrant women living in the UK, to escaping violent and abusive relationships. And that's something that could happen right now, we're lobbying the government for.
I notice that so many governments are way behind the curve, not just governments, but institutions. Institutions are way behind the curve often in understanding what they needed to do to make systemic change, which would have made this crisis something that everybody could have lent a hand and helped deal with. Whereas the kind of top-down certainty often of many governments, where they're working to an old script and haven't included women in a new script, those are the societies where they're really letting their citizens down. But I'm going to come back to you, Agnes, which is if you were to give a kind of global view about what you'd like to see in terms of women's health. Just a small question there. What is it that you
Absolutely, and I'm going to answer with a bias. I want more women in leadership position. And look at this pandemic. Countries that were led by women are all doing well because they are not selfish. They don't put politics before the need of the vulnerable. They put the need of the child and the vulnerable woman at the front of their reaction. So, my answer will be put more women in leadership starting today and don't hand before 2 or 3
Mhm.
century from now. So, and there is no way to do differently because we need a change in policies. To change policies, we need a change in laws. To change laws, we need change in constitutions and put the right of the vulnerable and the right of the woman in the heart of the right protected by the constitution. Then we will start to say, we have make a breakthrough. And we can start thinking about the right to health, the right to family planning, the right to reproductive health, the right to safe delivery, the right to keep primary health care for women and for their families in the heart of a response like a crisis like this one.
Mhm. So
So
I
there
think,
is a lot to do.
mhm. Well, nailing the idea that women's leadership is essential, not women being assistants, not women leading from the back and telling somebody else what to do, but not getting any credit for it, but women actually leading from the front and being valued properly. So I just read you a quote because we are going to come to domestic abuse several times during this 24 hours. As soon as the pandemic hit, immediately the Secretary General Antonio Guterres of the UN said, I urge all governments to put women's safety first as they respond to the pandemic. So it wasn't unknown. It wasn't unknown. But I think most governments didn't. But the ones that did will be applauded, and many of them were women led. So I'd like to thank you as panelists. I mean, I'd like to thank you because I know as health workers and activists, your day is full every day and you're rushing off to do other things. So to take the time to speak to all of us globally and just say, how can we be together as women around the world? This is so generous of you. And thank you very, very much indeed. You won't be forgotten.